Welcome to another beautiful episode of Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Alhassan. Now, according to International Diabetes Federation, Nigeria is one of the 48 countries in the IDF African region. As of 2021, there are approximately 3.7% adults in Nigeria who have diabetes, which translates to 3,623,500 cases of diabetes in adults. A study conducted in 2017 found that about 4.7 million Nigerians aged between 20 and 79 years had type 2 diabetes. The World Health Organization provides an overview of diabetes burden, the interventions available to prevent and manage diabetes, and recommendations for governments, individuals, and the civil society, and also the private sector. Today on the program, Cardiothoracic Nurse Jumbo Emmanuel joins us to shed light on diabetes with a focus on causes, preventions, and management. But before bringing him into the studio, let's take some health roundup stories for this week. Yeah, welcome to the studio.
Thank you so much.
How are you doing
Anyway,
today?
I'm very fine.
All right.
So,
According to the overview of diabetes, we know that it's a common ailment that has come to stay. But let us understand what it really is by starting from the scratch. So what is diabetes?
so we say that diabetes can be referred as a chronic disease, which is characterized by a high level of sugar. We can say it's glucose in the blood. So it's a high level of glucose in the blood.
Okay. It's a high level of glucose in the blood,
Yes.
you said. Okay, so how do we get this high level of glucose in the blood? Because I know that glucose has to be present in the blood. So when does it become too much?
Okay, it has a range. Mostly when we check, it has a fasting range, it has a random range. Mostly the range for glucose for fasting should be from 60 to, or from 80 to 100. You understand? So when it's above such limit, we say that it is high for a fasting. That's someone who has not eaten.
For
So
up to how
that's,
many hours?
sorry,
Someone who has not eaten for up to how many hours?
that for for 8 hours.
Okay.
That's a fasting test, the one you do early in the morning.
Okay. So what about the other way? What if you have eaten? What's the maximum sugar that should be present in the body?
It should be below. It should be below. It should be below 200 milligram per dl.
Okay.
That is
So,
the percentage. Yes.
okay, with this now, what are the supposed symptoms that are associated with diabetes?
In the diabetes, we have several symptoms. Number one could be increased, that's frequent urination. You can also see the person feeling tired. You see loss of weight. There's increased thirst. You understand? There's also this increased hunger for the person. Person feels like eating more.
Okay. Are those the only
So
symptoms?
these are one of the signs and symptoms. We also have blood vision, wounds that tend not to heal. That's one of the last stage symptoms you can get. Mostly these wounds can occur at the foot.
All right. Whilst I was making my research, I got to learn that diabetes comes in different types. So what are the types of diabetes?
Okay, majorly we have three types of diabetes, which is type 1, we have type 2, and gestational diabetes. So when we talk about type 1 the diabetes, we say that it is an autoimmune condition in which your immune system attack and destroy its own producing cells. That's in its own insulin producing cell. So this occurs directly at the pancreas. That is where this occurs. That's for type 1. Now at this stage, the person or the individual tends not to produce enough insulin, or there's no production of the insulin. Now in type 1 the diabetes, it occurs mostly at tender age or adolescent. We can also see it at any age bracket. Now, when we now look at this type 2, type 2 is more like it occurs slowly, not as fast as that of the type 1, while the gestational diabetes occur with those who are pregnant. Now, you might ask, what is this insulin that we are talking about? Now, insulin is a hormone in the body that regulates blood sugar level. You understand? It tends to regulate it, and it is being produced in the pancreas.
Okay. So, what are the risk factors for developing diabetes? And
Okay.
do they vary according to the type that the person has?
Yes. So when we talk about majorly, the risk factors that can expose one to having this the diabetes, i.e., whether it's type 1, type 2, or gestational diabetes, is increased consumption of carbohydrate food. So when we talk about this carbohydrate food, it simply means those foods that are high in sugar. You understand? Those foods that are high in sugar. And also people who are obese, people who consume a lot of junks. You see these sugar containing drinks. You understand? Or you can get at the roadside. These are some of the things that predispose one into having this TM. Lack of exercise. As much as people eat, they tend to exercise. So the body therefore does not get rid of this sugar content either through sweat. So you see that they don't exercise. So you can as well. Another risk factor is hereditary. If someone in the past from your lineage has had this diabetes, there's every tendency that one can still get it. So these are the risk factors of having this diabetes.
So that means that it's something that can transcend from very likely generations to generations.
Of course.
But are there situations where some families don't even have any trace of diabetes, and then somebody in the family can come up with it?
Of course, yes, absolutely. There are situations like that. Now, when you talk about type 2, mostly you see these cases in type 2 the diabetes. One tend to come up with this without any trace. Now, you can get this, just like I said, consumption, high consumption of carbohydrates intakes can make someone to develop this. Or there are also some disease conditions that can also affect the pancreas, which can also tend to expose one into having this disease, which is diabetes mellitus.
Sorry, could you come again?
So I said that there are also disease conditions such as infections that can affect the pancreas or also other part of the body, but indirectly they affect the insulin level. You understand? Whereby it makes it difficult for this carbohydrate to be reduced in the body.
All right. I've heard that diabetes tend to be like a gateway for other ailments to come into the body. How true is this?
Absolutely, it's very true. Mostly, when we talk about diabetes, it can result to other type of ailments. When we talk about majorly, we talk about cardiovascular disease condition. It can also affect the eyes. You understand? When the eyes, whereby this individual start to get a kind of blood vision, you can't see clear, you can't read clear, you can't see well at night. Now, mostly we have noticed that, or research have proven that most people uh, with this disease tend to develop or have cardiac arrest, whereby the heart stops functioning for a period of time, just a seconds, and kick back. You understand? Or whereby there is a reduced blood flow to the heart. This can be as a result of excessive or cholesterol intake, which narrows the blood vessel. All these things are all surrounding around the diabetes. So they tend to form a link. When we talk about the eyes, the heart, the body system, the lungs, and also they all affect each other. Whereby there is a problem in the pancreas, it can also affect other body system.
Wow. Honestly, this is almost overwhelming. But now let's talk about how this is diagnosed. How is diabetes diagnosed? How will someone know that, okay, this is diabetes, and how is it actually diagnosed?
Now, the diagnosis of the diabetes can be done in different ways. Just like I said, we have fasting. We have a fasting glucose test which can be done prior to before this individual takes the first meal. We have also oral glucose test. These are tests we do in order to assess the glucose level. We have what we call HbA1c. We also do this test to assess the glucose level. Majorly, it is now left for the healthcare provider to now note or denote which type of the diabetes that this individual have. So for that of the fasting, just like I said, the range should always be between 80 to 100. Now, for random tests, while the person has finished eating, it should be between 170 to 200 milligram per dl. Then two hours after food, it should be between the range of 120 to 140 milligram per dl.
Wow.
So these are some of the ways whereby we can diagnose this disease.
All right. I wanted to ask you a few more questions in relation to your field as a cardiothoracic nurse. But before that, let's talk about the complications of diabetes.
Okay. So when we look at or want to talk about the complications of diabetes, there are a lot of complications that surround this diabetes. Just like we said, blood vision. One can develop blood vision, wound that tends not to heal. Mostly, there is a frequent urination. The person begins to feel tired and weak. You understand? And most times, when you don't manage this properly, mostly where it occurs is at the foot, where there is wound that refuse to heal. It can surely lead to amputation. You notice that most times this individual, they tend to, when this wound refuses to heal, it tend to produce a foul smell, which is not accommodating for people around and for yourself. You won't feel comfortable being around people and with yourself. So these are one of the complications. It can also lead to heart failure. You understand? So it's a very severe disease in which one need to take care of and monitor. It's something that you need constant monitoring. You check the glucose level always to make sure that it is in normal range. And when it's not in normal range, you tend to report back to your healthcare provider.
Wow. So now let's look at your field majorly. How does diabetes, impact cardiovascular systems?
Diabetes has several impacts on the cardiovascular system. Now, majorly, as I mentioned before, that all these disease condition lines together with it affects different systems of the body. Majorly, when we talk about the heart, now individual who has this diabetes mellitus, the heart tends not to produce enough blood that will circulate the system, whereby the blood vessels that carries blood tend to narrow, which is as a result of plaque. Excessive cholesterol narrows the blood vessels of the heart, that's the coronary artery, whereby reducing blood flow to the heart and its ability to pump blood effectively. So that is one of the reasons whereby this individual does not get enough blood flow at the lower part, at the foot region. You understand? So the energy the heart requires to pump blood to the lower foot tends to reduce. This makes wound heal very slow. You understand? With the accumulation of high glucose level, which is hyperglycemia, this wound tends to heal very slow, and sometimes it might not even heal. You understand? So in other words, it can also lead to cardiac arrest. Most people, you see them, they'll be like, I'm getting a sharp pain. You understand, at the heart region or at the back. This is a kind of stress in which the heart tends to use to pump this blood. So it all connects to each other.
All right, so what are the specific challenges and considerations for managing diabetes in cardiovascular patients with cardiovascular diseases?
Okay, when we talk about the management of diabetes, we manage them based on the types. You understand? We manage them based on the types. When we talk about type 1, it has its own management. Type 2, it has its own management. So when we look at type 1, the diabetes mellitus is majorly managed by insulin. So another name for it is insulin-dependent diabetes, because majorly it depends more on insulin. Why that of type 2 is non-insulin dependent. Majorly it can be managed through diet, through exercise, or medications too. So that's the way whereby we can use to manage this the diabetes. We can also look at loss of weight, to reduce weight, and also to reduce cholesterol consumption. Whereby when we tend to reduce this cholesterol consumption, you notice that the blood vessels will go back to normal. There will be nothing obstructing it. You understand? This person will maintain a healthy weight or healthy lifestyle. Will also help. Now, continuous glucose checking is also important in terms of management of these patients with this disease.
Okay, so what challenges do you face in treating these patients?
Okay, the major challenges we face in times of treatment, most patients, especially those on insulin dependent, they tend to say that there is no financial, that the cost of this medication is high. So these are one of the challenges, therefore predisposing them to this disease moving over to chronic stage. Another challenge whereby we face in this diabetes disease is that most people at the rural age, whenever they see this people developing foot ulcer, they tend to line it down to a kind of community cause, or as a result of belief. They tend to say that this particular foot ulcer is caused by either their or their grandparents. So I think they need more health education on this severally. And you notice that most people, when they begin to come to the hospital, is when this foot ulcer has gone to a higher rate, whereby it only requires amputation.
Wow.
And which make the cost of treatment even high at this stage, rather than coming to the initial stage whereby it can be managed. Diabetes can always be managed properly, but you notice that most people tend to hear from outside instead of hearing from the professionals and to give them the right information.
All right, let's quickly go on a break. When we return, we'll talk more about the treatment options and the management. All right, viewers, let's go on a quick break. When we return, cardiovascular nurse will still be here talking to us and shedding more light. Stay with us. Come back, viewers. You're still on to Healthy Living, and we're still discussing diabetes with a focus on the causes, prevention and management of diabetes with Cardiothoracic Nurse Jumbo Emmanuel. All right, Emmanuel, before we went on the break, we were trying to discuss some of the management options. And part of the things you talked about was problems with insulin in the body. So let's talk about how there can be management and then infusion of insulin in patients that have cardiothoracic issues.
Okay, let's look at for the management, majorly that's type 1 diabetes, person who is on insulin dependent. So for this patient, we normally give them insulin. It has a range, so the doctor will prescribe. And before giving this insulin, it's always advised to check the glucose level of this person, because one of the complications also we can get from this is this individual going into hypoglycemia, which is very bad. It will not be good for the person. So it is always right to check the glucose level before giving. So if it is too high at that moment, you can give. When it's too low, you will not give, because that patient can go into hypoglycemia. Now, for other management, let's look at type 2 management. For type 2 management, you can go for what healthy diet. So, well, this healthy diet also works well in type 1 and type 2 is also there. So the management is the healthy diet. Reduce the rate of carbohydrate intake, drink more of water, then exercise, reduce that's a cholesterol level. So these are ways whereby you can manage diabetes mellitus.
Okay, so what are the treatment options available?
Treatment option, number one we have insulin. It's always the first. You have insulin. You have oral glucose intake. You understand? We have metformin. These are some medications whereby we can give this individual. We have some higher brand will go for artificial pancreas. You understand? So these
It's
are some
possible
of
to
the,
get an artificial pancreas?
that's research, yes.
Wow.
So
Okay.
these are ways whereby we manage these cases. Three, actually, as I made mention of insulin, I made mention of oral glucose intake, which comprise of the tablet, example, metformin. We have also artificial pancreas, which is rare, but is also uh, inclusive. Then also another management, most people with DM, we can also encourage them to avoid any form of injury at all, any form of injury, because once there is injury, it takes time to heal. We encourage them to make use of toothbrush that are a kind of light, that are not that strong. We also encourage them to wear covered shoe, or they can put on stockings. So this will minimize the rate at which they get any injury.
Okay. So far, we've learned that diabetes tends to work alongside lots of cardiovascular diseases and all. But then, are there special ways to get treatment when you have cardiovascular issues?
Special ways to get treatment. There are no direct special ways, if not following the same pattern. The diabetes has the major cause of diabetes. We will understand is that diabetes occurs as a result of decreased insulin production and also resistance of insulin action. That's the two major cause of this diabetes. So there is no other way you can take care of this if not tackling these two. So it's either that the level of insulin production is low, whereby you give an insulin, or there's resistance of this insulin that is being produced, whereby you tackle the cause of this resistance. You understand? Either through diet, you work your diet, or exercise, you reduce weight, the level of cholesterol. So these are the major way of managing it. It applies to any system at all, whether cardiovascular or any other system. It applies to every other pattern of care.
All right, so what are some of the common myths about diabetes? Because I understand that some persons would often say, no, some persons live in denial because they have various myths around it. So as a practitioner, what are the common myths that they bring to your table each time you get to meet with your patients? Could you please share some of them with us?
Most patients, when it comes to diabetes, they don't believe. Even at the moment, you might see someone eating, consuming more of all these sugar containing drinks or food. You tend to tell them, and already you know, I must have interacted with them, knowing that yes, they have trace of this in their lineage. I'll be like telling them, see, reduce the way you take this. It's not, most of them will adhere to the instruction. Most of them will still come back with the effects when this has gone high. You understand? And some of them tend to say, well, whenever this comes to a chronic stage, they tend to believe that it must be their family member at home that is the cause, or they must have mashed something on the floor. You understand? That they feel like this is the cause of this. And whenever this comes up, their relative or friends will be like, go to this other place, let them take care of it. They will use all sorts of herbs. Remember, this is not dealing with a physical, it's all about the internal. This affecting the pancreas, but they tend to treat it at physical using all sorts of things. Some might even go to the extent of using sand, red mud to treat something. And you notice at this stage, the case is worsening, and it might even result to us another degree of injury. Some might even go to the extent of leading to cancer of the bone, where it leaves the tissue and affects the bone entirely. So these are some of the cases we meet every day. And the level of this diabetes mellitus is increasing day by day. Mostly that of type 2 is increasing day by day. And we also advocating both in the rural areas, trying to teach them on some of the signs and how to take care of this disease. We also go as far as educating them on how to use the glucometers, a kind of machine they can take at home to check their glucose level, to make sure that it's a normal range. Understand? So these are some of the things we do.
Because I believe it's very important to especially see that people just tend to create different myths around different ailments. They just believe that is what is happening, and so many of them actually live in denial that they do not have diabetes. Now, part of the moves of some other healthcare practitioners, NGOs, and Diabetes Society of Nigeria is to ensure that sugar-sweetened beverages have a specific additional tax on them that discourages people from buying, and for those that are buying, the extra percentage that is on it and tends to go into the treatment of diabetes. But now let's talk about other means of being prone to diabetes, because it's not just sugar sweetened beverages, especially knowing that some of our meals are actually sugar related. How do we begin to handle this?
Now, in terms of this situation, whereby some of our meals are being, we consume here in Nigeria, we consume more of carbohydrate food. That is why we have what we call diabetes diets. We have what we call diabetic diet. Most people does not really know about this diabetic diet. This whereby a professional who is mostly a nutritionist or a healthcare professional can direct you by telling you that this is the amount of meal you should consume. You understand? Most people consume something like bread. You understand? At least someone who is diabetes has to consume at least 2 slices of bread is okay. Then in a plate, let me say for example, in a plate, you divide the plate into 3 parts. That's the quarter, half of it should only contain carbohydrate food. You understand? The other part should contain vegetables. You understand? So these are some of the ways whereby you take care of diabetes patients. Diabetic meal or the diet is very, very important and very essential, because it has a very long way to play in management of this case.
All right, earlier you talked about people that are obese. You said they are also prone to diabetes. Does that simply mean that sedentary lifestyle can actually aid, diabetes in the body?
Yes. I might mention that one of the things, or one of the ways whereby we can curtail or manage diabetic cases are exercise.
Okay.
So whereby someone who consumes a large amount of food, at the end of the day, you end up sleeping or relaxing in a particular position, or not really making a kind of active motion or doing anything. This body tends to liberate more of this glucose. They are not in use. You understand? They are not in use. But when you are engaging yourself in different activities, this glucose, they are now in use. You can use it in different activities. But wherever you are accumulating it, it tends to increase. And the more it is increasing, is the more the person is prone or at risk to moving into chronic stage of this diabetes. So when we mention sedentary life, it's a kind of exposes one to DM the more.
Wow. Because I feel like the situation we all have in this country nowadays, most persons work 9 to 5 jobs, some even work longer, and eventually they get to their homes, from the car to their homes, and barely do so much of activities, which means that would be one of the reasons why it is most prevalent in Nigeria.
Yes, yes.
So what are some lifestyle changes that can help prevent diabetes?
Okay, some lifestyle changes that could help one prevent diabetes is consumption of alcohol. You understand? Consumption of alcohol, the rate of alcohol intake can also help one. Smoking could also play a role. Diet, as we mentioned, could also play a role. Uh, mm, mm, Diet could also play a role. We talk about we have passive and active exercise. So depending on the particular exercise the person wants to engage in regularly, most people don't really check their weight. You understand? So it's appropriate for one to also check his or her weight. There's what we call BMI. You calculate your BMI to know if actually you are obese. You
What is
understand? If
BMI?
yes, if actually the person is obese, you understand? So the person should know that. So if you are obese, you work on it or meet your healthcare professional. He or she will teach you on how to reduce your weight.
Okay, you mentioned BMI. I wanted you to shed light on what BMI is.
It's basic mass index, basic body mass index.
Index.
You understand? This BMI involves you calculating your height and weight. You understand? You divide it. You know there's a normal range for it, whereby you know if you are underweight, if you are obese, if you are normal. You understand? So some of these things is something that we need to know, and subsequently, one can as well go for this cholesterol test to ascertain or to know the level of your this cholesterol, because it's not just focused on the that of DM, that's the diabetes, but it also helps you to regulate your heart also. You know that the diabetes and the heart, they work hand in hand.
All right. You've talked about treatments and management options in most patients, but you specifically didn't talk about pregnant women because you mentioned gestational diabetes. So I want to believe that because of pregnancy, there has to be a different way to manage diabetes in pregnant women.
Yes, for that of the gestational diabetes, for that of the gestational diabetes, already I've mentioned that we have type 1, type 2, and the third part, which is gestational diabetes. So this majorly occurs in pregnant women. You understand? So because of the hormonal change in pregnancy, they tend to develop this. So because of this, majorly we also put them on diets, the diabetic diets, you understand, to regulate the level of their glucose, and also we encourage them to do continuous glucose monitoring. We monitor their glucose level to the glucometer machine. They use it to monitor their glucose level to make sure it's normal range. So you notice that after childbirth, the glucose level tends to go back to normal. So it's just as a result of the pregnancy.
Okay, but are there cases where after pregnancy they tend to have a reoccurrence of diabetes?
There is also a case of that. For that, not just pregnancy, but where, let me say, one tends to just notice that he or she has diabetes. We call it pre-diabetes. That we will classify that as a kind of fourth type of diabetes. We call it pre-diabetes. So at this stage, one can just check it. You can check and notice that, oh, it is high this month, but next month you notice that it has gone back to normal. So this particular one, we call it pre-diabetes.
All right, parts of the lifestyle modifications that you talked about, I just remembered the conversation around portion control. So does this help mitigate the risk of diabetes too?
Pardon, please.
Okay, I said part of the lifestyle modifications we're talking about. And I learned about portion control. So does portion control help to mitigate the risk of diabetes?
Of course, it does. It plays a very vital role in terms of regulating the glucose level and the way insulin reduce the blood glucose level. So it plays a very good role.
All right, so what responsibility do you take when it comes to debunking fake news around diabetes? Because most importantly, by the time you search the internet, you find a lot of unorthodox solutions to diabetes, which I don't know if you can confirm if there are unorthodox methods to treat diabetes or not. I think we should start with that. Are there methods that can be used to treat diabetes without properly going to the hospital for drugs? I mean, unorthodox methods.
Okay, for presently, I would say I don't believe so because most people, I will speak for the part that I know. For that of the Orthodox, they are not scientifically inclined. They teach or they practice based on what they are seeing. You understand? They practice based on what they are seeing. But we have facts and figures and we have backups. That means that we have the right treatment to that. You understand? They practice based on noticing that wow, this person's leg is swollen. You understand? And for that reason, they are doing everything they can to make sure that that legs go back to normal. That is why most people, where you see them based on the Orthodox, they tend to use the mold sand, the mold, this red mold, just to patch it at that area. But just like I said that diabetes occurs as a result of two factors. It is either there is decreased insulin production or there is increased resistance of this insulin in the body, whereby once a healthcare professional is taking care of this individual, he or she is targeting these two factors. It's either these two factors are the cause. It's either there is a way whereby the pancreas is not producing enough insulin to tackle to reduce this glucose level, or whereby there is a resistance whereby this insulin is being produced, but something along the way there's a kind of resistance whereby the body does not make use of it properly. So I don't believe that Orthodox medicine that they really have the cure or they have a perfect management to this diabetes mellitus.
All right, so in 60 seconds, could you please enlighten our viewers on management of diabetes as your roundup statement?
Okay, management of diabetes, it can be managed at home. You understand? It can be managed at home properly, and you don't need to put in fear whenever someone says that you have DM or diabetes. Simply, the first thing you should do is to monitor your diet. You understand? A good healthy diet plays a very nice role. Reduce the level of carbohydrates, reduce the level of alcohol intake, put more of effective or regular exercise. This will help you promote healthy lifestyle. Now, continuous monitoring of glucose level will also help you. Now, if you have any regimen of insulin, whereby your doctor prescribed the insulin and said you should take it accordingly, please kindly follow the treatment regimen accordingly. So this will help to promote a good, healthy living pattern for you and to promote your health system.
Thank you so much, Cardiothoracic Nurse Jumbo Emmanuel, for your time today. We really appreciate you.
Thank you so much.
You're welcome.
I'm grateful.
Our viewers, I hope you've learned a thing or two today, and I hope you do well to manage your health and observe the lifestyle modifications that you need. That's all we'll draw the curtains today on the show. I am Olamide Alhassan. I'll see you again next week.